Measles. What exactly are they? In our lives, we often hear that someone got infected by or cured of measles, but what exactly are they? Measles are highly contagious as they can be easily contracted through inhalation or direct contact with infected secretions in the mouth, nose, and throat. These respiratory droplets are released by coughing or sneezing containing the measles virus. Once entered into the body system, the lymph nodes, respiratory vessels, blood, and other internal organs are all infected. It remains active in body for around 2 hours, and any carrier of the virus is able to transmit the disease anytime 5 days before showing symptoms. 10 to 12 days after the initial exposure to the virus, cold or flu-like symptoms such as cough, high fever, watery eyes, and Koplik spots, which are dots in the throat, appear, often used as an early indicator of the virus. Rashes then appear shortly after initial symptoms, begins on the face, head, and upper neck, gradually spreading down until it reaches the hands and the feet. These usually last around 5 to 6 days. Having a complication with measles depends on the patient's age. Children under the age of 5 years old and adults over 20 have a higher probability. When complications occur, the nutritional status, immunity, and general mobility of the patient may actually worsen over time. Minor complications are usually dehydration, diarrhea, and ear infections, major complications being pneumonia, inflammation in the brain, and blindness, all which may result in death. After 2 weeks, physical symptoms starts disappearing, virus declines and dies off due to the body's immune response. By the 3rd week, signs and symptoms will disappear. All this happens when measles are left untreated. There are 2 types of evidence-based approach to treating measles: the most expensive and the least expensive. The most expensive would be to be sent to the hospital due to the doctor's fee, intensive care, antibiotics, and many more, while the least expensive would be to take a vaccination. Since its help in prevention in measles, high cost of treating the measles will be avoided. A doctor in a minor case of measles would generally recommend rest, drinking more water, and using a humidifier to help ease cough or sore throats. Prevention is always the best option. In a case of measles, vaccination is the best choice. If prevention has not worked and patient has acquired the disease, the best possible action is to seek advice from a doctor. From there, the doctor will either suggest you to rest at home and drink a lot of water, or receive an extensive treatment in the hospital. The best option purely depends on the extent of the measles. In a minor case of measles, the least expensive option is the best, while in a riskier case of measles, the more expensive option is the best for the best possible outcome. The best suggested health professional for measles treatment are doctors, as they are able to prescribe the needed antibiotics and identify the measles disease by either investigating the rashes on the skin or conducting a blood test.
Created using Powtoon.